Hello everyone, welcome to Is It Safe? My name is Naira, your favorite hostess. Today we're going to be talking about Metformin, which is an antidiabetic, also known as glucophage. This drug is a treatment for type 2 diabetes, and its management can be used with a diet, insulin, or as an oral hypoglycemic. Its actions are to decrease hepatic glucose production, and it also increases your insulin sensitivity. It is known to enter the breast milk, and also it's eliminated almost entirely unchanged by the kidneys. Today we have Kirsten Owens, one of our specialists, that's going to be talking about the adverse effects and the cautions. Please, everyone, welcome Kirsten Owens.
Hello, everyone. My name is Kirsten Owens, and I'm going to talk to you about what contraindications and cautions for metformin. So, if you have any allergies to the medication, then you should not take it because you can experience a hypersensitivity. You should also not take it if you have metabolic acidosis. Don't use this medication if you experience dehydration, sepsis, hypoxemia, excessive use of alcohol, or renal dysfunction. Also, use consciously if you have concurrent renal disease, you're a geriatric or a disabled patient or a debilitated patient, chronic alcohol use, serious medical conditions such as heart attack or stroke, if you're undergoing serious stress, hypoxia, pituitary deficiencies, or hypothyroidism, or if you're pregnant, lactating, or if you're under the age of 10.
Our second specialist on the show today is going to be Annette Cazares, and she's going to be giving you some further information on this medication. Everyone, please give a round of applause for Annette Cazares.
Woo! So today I will be talking about adverse reactions caused by metformin. Some adverse reactions that you may come across are going to be abdominal bloating, diarrhea, nausea and vomiting, unpleasant metallic taste, lactic acidosis, decreased vitamin B12 levels. Some drug-drug interactions that you may find are going to be acute or chronic alcohol ingestion or iodinated contrast media, which increases the risk of acidosis, digoxin, ranitidine, Zantac, calcium channel blockers, vancomycin, cimetidine, furosemide.
Okay, and now for our nursing considerations and patient family teaching, we're going to be presenting our specialist, Pisa Bodo. Can I get a round of applause for Pisa Bodo?
Woo! All right. How's everybody doing today? Okay, so for nursing considerations, what would you do as a nurse? Okay, so what we need to know is that patients who develop an illness or any lab abnormalities should be assessed for ketoacidosis or lactic acidosis. We want to assess serum electrolytes, ketones, glucose, and if indicated, maybe the pH, lactate, or pyruvate, and the metformin levels as well to see if acidosis is present. We want to monitor their glucose, their serum glucose, and their glycosylated hemoglobin or their A1C periodically during their therapy to evaluate the effectiveness of the therapy. We also want to assess renal functioning before initiating and at least annually during their therapy. We also want to monitor their serum folic acid levels and vitamin B12 for those used in long-term therapy use because metformin can interfere with the absorption of those. And patients who are having surgery should be have this medication temporarily discontinued. We want to administer the medication orally to minimize GI effects, and if they're taking the extended release tablets, we want to make sure that the patients take the medications whole, and they should not crush, dissolve, or chew. For patient or family teaching, the patient should be advised to take the medication at the same time each day as directed. Take missed doses as soon as possible, unless it's almost time for the next dose. We want to encourage the patient to follow the prescribed diet, medication, and exercise regimen because that could prevent hypoglycemic or hyperglycemic episodes. We also want to inform them that metformin might have an unpleasant taste, an unpleasant metallic taste that could be resolved spontaneously. Also advise the patient to carry some sort of sugar, whether it's hard candies, or anything like that, and to wear an ID bracelet describing their disease and the disease process. Also want to emphasize the importance of follow-up exams, of regular testing for their blood glucose, their A1C, their renal function, and then of course, hematologic parameters. All right, thank you.
Okay, so after all of the information we have received, I'm going to welcome all of the specialists back on the floor with me, please, if everyone can join me. I just want to thank all of them for taking the time to give us all of this information. And now, the big question. Is it safe?
Yes!
Thank you everyone for watching, and I hope everyone has a fabulous day.